I will be going over what type 2 diabetes is, how it is diagnosed, and the symptoms of the disease. Now, before we get into it, I want to make sure you guys know the distinct difference between type 1 and type 2 diabetes because there is two groups. So type 2 diabetes is the one that is more preventable. It is more common in older 45 years and up individuals. Hello, everyone. I will be going over what type 2 diabetes is, how it is diagnosed, and the symptoms of the disease. Now, before we get into it, I want to make sure you guys know the distinct difference between type 1 and type 2 diabetes because there is two groups. So type 2 diabetes is the one that is more preventable. It is more common in older 45 years and up individuals, and it is the one that is more preventable based on your lifestyle and your activity levels and your weight, things like that. Now, type 1 diabetes is the one where the body is insulin dependent. Your body isn't making enough insulin. And it is also the one that is not as preventable, and it is more common in developing in younger children and teenagers. So I'm just making sure you guys know that distinct difference before we go on. Now, let's get into it. Type 2 diabetes is a chronic long-term disease that prevents the body from using insulin properly. So individuals with type 2 diabetes are said to be insulin resistant. So that means their cells and their muscle, fat, and their liver become resistant to insulin. Because these cells don't interact in a normal functioning way with insulin, they don't take in enough sugar, which allows them to develop type 2 diabetes. Or it could be because their pancreas is unable to produce enough insulin to manage their blood sugar levels. Type 2 diabetes is diagnosed by measuring your blood sugar levels, such as fasting plasma glucose levels, also known as FPG. That is one way. Another way to be diagnosed is using your glycated hemoglobin test. So this indicates the average blood sugar level for the past 2-3 months. If anything below 5.7% is normal. However, if you have a 5.7 through 6.4% blood sugar level, that means you have prediabetes, meaning that you are at risk of developing diabetes if you continue the lifestyle that you have. However, if you have a 6.5% blood sugar level or higher on two separate tests, so they have to test you twice, this indicates that you have type 2 diabetes. Now, this is all done through blood work, just so you know. So some of the symptoms of diabetes include fatigue, tingling in your hands or feet, slow to no healing, unintended weight loss, and the rest of the symptoms will be shown on the next slide. Here are the rest of type 2 diabetes symptoms. The other symptoms include frequent urination, frequent infections, blurred vision, increased hunger, and areas of darkened skin, typically around your neck or your armpits.
Okay, so for quality of life, in this slide, we'll talk about how to manage type 2 diabetes. Although managing type 2 diabetes requires a mix of lifestyle changes and medication. So healthy eating, exercising, watching your blood sugar levels, watching your weight, and maintaining a healthy diet all contribute to managing type 2 diabetes. So like I mentioned, overall, being more conscious and strict on what you are eating and maintaining a healthy lifestyle with exercise and watching your blood sugar levels all help with managing type 2 diabetes. So, what is the prognosis? The prognosis in people diagnosed with type 2 diabetes varies. It depends on how the individual modifies their own risk of complications. Treatment plans will most likely need adjustment over time because insulin resistance can increase with age. Majority of type 2 patients will require more than one medication to keep their blood sugar under control.
Hello, I will be talking about how the risk of type 2 diabetes is distributed, especially among Hispanic and Latino adults. Now, we all know people of certain racial and ethnic groups are more likely to develop prediabetes and type 2 diabetes. Now, this includes African American individuals, Hispanic Latino Americans, Asian Americans, and Native Americans. So we also have to take in mind that Hispanic and Latino Americans are at a significantly higher risk of developing type 2 diabetes. Now, we have to keep in mind that Hispanic and Latino Americans make up a diverse group of people. So this includes Cuban, Mexican, Puerto Rican, and South and Central American or other Spanish cultures and races. Each has its own history and traditions, but all are more likely to have type 2 diabetes. In fact, all Hispanic groups are 17% more likely than non-Hispanic whites, which are 8%, to have type 2 diabetes. Now, this is just an average for all Hispanic and Latino American groups. The chance of having type 2 diabetes is actually more closely tied to your cultural background, the specific one. So for example, if your heritage is Puerto Rican, you're about twice as likely to have type 2 diabetes than someone whose background is, for example, South American. US adults typically overall have a 40% chance of developing type 2 diabetes. However, if you're a Hispanic Latino American adult, your chance is more than 50%, and you're likely to develop it at a younger age. And it's also diabetes complications hit a lot harder. And when you're a Hispanic and Latino American, you actually have a higher rate of developing kidney failure and caused by the diabetes, as well as diabetes related vision loss. So that's something to keep in mind with the risk factors contributing to type 2 diabetes. So Hispanic and Latino cultures also have foods that are high in fat and calories. So when they're eating these foods that are high in fat and calories, for example, tortillas, beans, rice, and all of that, it's not helping when in terms of putting them less at risk at type 2 diabetes. In fact, we all know that the way you eat and your activity level contributes to your health. And when their foods are high in fat and calories, it's not ultimately helping contribute to their health. And it's harder to get rid of, especially when it's a part of your culture and it's part of the tradition. So also family celebrations in Hispanic culture can involve social pressure to overeat, and turning down food can be actually seen as impolite in some cultures. And it's also been noted that Hispanic Latinos have higher rates of obesity, and they tend to be less physically active than non-Hispanic whites. And some see overweight in some cultures as a sign of health instead of as an actual health problem. So it's just important to keep in mind the cultural factors that contribute to the higher risk. It's not something, if it's a part of their lifestyle, it's definitely something harder to get rid of, but it does contribute to their risk of developing type 2 diabetes. It's important to keep in mind that these risk factors are general and they may not apply to the actual individual Hispanic Latino people or the specific Hispanic groups.
Hi everyone, my name is Jesus. I'm going to talk about the significance. So according to the Center of Disease Control, CDC, more than 34 million Americans have diabetes, about 1 in 10 persons, and approximately 90 to 95% of them have type 2 diabetes. Type 2 diabetes most often develops in people over age 45, but more children and teens and young adults are also developing it. Significance. As you can see in this fast fact on diabetes, about a total of 34.2 million people have diabetes. That's 10% of the US population. Also diagnosed, out of those 34 million, 26.9 million people, including 26.8 million adults. And of course, we have a big number of people that are undiagnosed because they don't go to any checkups. That includes 7.3 million people. That's about 21% that are undiagnosed.
And here we have a CDC National Diabetes Statistics Report from 2020. It is a graph representing the various groups that are especially affected by type 2 diabetes, and it is age adjusted. It is estimated prevalence of diagnosed diabetes in the United States. So just keep in mind that these are people who actually went to get diagnosed. There is actually a high amount of people who go undiagnosed who might actually have the disease. So this is going for the adults in the United States, and these are racial and ethnic groups that are especially affected. As you can see here, the American Indian group has a significantly higher prevalence, and Hispanic is a close second, especially amongst the men. So go ahead and take a look and just see and compare how type 2 diabetes is prevalent more in one group and less than the other.
In conclusion, and to sum up everything my peers stated at the beginning of our PowerPoint presentation, type 2 diabetes is a preventable and manageable disease with the right care and treatment, of course. If someone is living with type 2 diabetes, they have to make sure to maintain a healthy weight. This will prevent them from either increasing the disease, meaning them having more complications leading to possibly cardiovascular disease or high blood pressure, cholesterol. So maintaining a healthy weight is crucial, along with making healthy food choices. And of course, staying active. Simply walking 30 to 45 minutes daily can make a great impact in the long run. Staying away from junk food and sugars is also an important part of maintaining a healthy weight and managing type 2 diabetes. Of course, making sure the patient is having annual checkups. We want to make sure, again, like Melina has stated, it is all done through blood work. So making sure the patient is having regular checkups annually or every 3 to 6 months. Because when someone is getting their hemoglobin A1C checked, that is usually a 3-month test. It happens every 3 months. And of course, we want to make sure that the patient avoids any habits like smoking and drinking, because this can lead to other complications when a person is diagnosed with type 2 diabetes.